Hello, good morning. You are in webinar number 2 of 3 webinar training series brought to you by the California Working Family Coalition and the California Partnership to End Domestic Violence, Accessing Paid Leave Now. Thank you so much for being here. Working Family Coalition, I'm going to hand it over to Jenya, who is the Coalition Director, so that she can tell us more about the Working Family Coalition.
Hey, good morning, everybody. I'm really excited to see people from all over the state. I just want to introduce the California Work and Family Coalition. We are a statewide alliance of different organizations, and we really come together in the belief that everybody should have the right to time and enough resources to really care for yourself and your family. And especially right now, this is really important. And we're really, we had planned this series a while ago when it was going to be in person, but moved it, of course, to an online. And it seems like, you know, the need for this information is even more important than ever. And I really appreciate all the coalition members and everybody coming together to put together more information on how COVID-19 affects these laws. But in general, all of these organizations and all the people in California really need to know their rights. The coalition came together to pass the first paid leave law back in 2002. And ever since then, a lot of what we do is really about equity, making sure that people can access paid leave. And part of that is working in partnership with organizations like the Partnership to End Domestic Violence, Legal Aid at Work, Center for Work-Life Law, ROC LA, Chinese Progressive Association, all the different groups that come together in this belief and are, you know, working on this type of training. So I really thank everybody for coming and hope that you'll share the information with your organizations and people. Next. Yeah, so that's, go ahead, Alejandra. Oh, and
Thanks
then,
so much, Jenya. Yeah.
Oh, okay. So, and we are in partnership with the California Partnership to End Domestic Violence. One of the things that we find is that paid leave not only helps people in their health and well-being, but it also is a preventative for domestic violence. It helps build healthy relationships, and economic security is really the key to all of that.
So hold on one second, because you're giving them the answers to the next question. Hold on. Hold on. All right, so we do have a question for everyone. Why is the California Partnership to End Domestic Violence here? So I am launching a poll to hear from you all, those who were in the first session. If you wouldn't mind taking a moment to answer, and those who were not, what are your thoughts on here? Is there a relationship between economic supports, including paid family leave, and the prevention of domestic violence? Is there a relationship between economic supports, including paid family leave, and the prevention of domestic violence? No, no relationship whatsoever. Yes, they help reduce financial stress. Yes, they foster equitable parenting opportunities. Yes, they promote economic independence. Yes, they promote gender equity in the relationship, or yes, for the other reason. If you have another reason in mind that supports that there is a relationship between economic support and the prevention of domestic violence, please type it in the chat so that we can see what you are thinking. The poll will end in about 15 seconds, and I will show the results to everyone. The results are coming in. We are at about 50% of folks voting. So please, if you have access to your computer, if you are on a screen, if you are able to respond, please do so now. The data helps us support the continued funding of these efforts. It shows that folks are showing up, that you're interested. I will stop talking so that you can respond to the poll. Five more seconds. Folks are still voting. I love it. Thank you so much. I'm going to end the poll so that we can see the results. From what you can see, yes, there is definitely a relationship, which is why the California Partnership to End Domestic Violence is working in collaboration with the California Work and Family Coalition. Economic dependence is one of the #1 reasons why folks stick around or remain in an unhealthy relationship, or unfortunately, one of the #1 uses of someone who manipulates or abuses their partner. So by helping to support and strengthen economic supports across our states, including paid family leave, we are helping to reduce financial stress. We are helping to foster equitable parenting opportunities. We're helping to promote economic independence, gender equity in the relationship. And as you are mentioning, there are also other reasons that help strengthen economic supports and prevent domestic violence. Thank you so much for showing up with your responses. We really appreciate you, and we appreciate the support with the coalition. Jenya.
Yes, thank you to our sponsors, Blue Cross Blue Shield, who's been working a lot on the issue of prevention of domestic violence and also on paid family leave, and is working with so many of our partners right now to really help with more education and more access to paid leave, which is really just such an underpinning of people's health and well-being and economic security. So we really appreciate their sponsorship for this and so much more. So we're going to go over just quickly what you're going to be getting today. So one of the key things we went over last time is how all the different laws kind of work together. But one of the big questions we get is really how to apply for paid leave and other wage replacement programs, including UI, that are related to COVID-19 right now. There's a lot of small and large changes that are happening at the federal, even the local and state level. And we'll be covering all of that, the access to these programs. Then the others is how to screen for eligibility. How do you talk to your partners, your members, your constituencies about their eligibility for paid leave, and how do you basically just point them in the right direction when they need it? The other thing that I think is really key with all of our different partners, including the EDD, who you'll be hearing from next, is really having the resources for more information. With the Partnership to End Domestic Violence, the California Partnership, we created a toolkit that we'll be sharing at the end and also in our next, and that we also have a lot of resources from the organizations here that you can use in your work to promote paid family leave. And now I think we are going to be, do we want to talk about all of our different partners? So today we're hearing from, go ahead, Alejandra.
Yeah, we've got we've got an awesome crew here today for you all. Just an amazing team of panelists, of trainers, educators, advocates, community organizers. I am a prevention specialist at the California Partnership to End Domestic Violence, leading our statewide prevention program. Jenya Cassidy is the coalition director, bringing us all together, making sure that we are showing up for paid leave. You are going to hear one of our first speakers is Juliana Franco, staff attorney at Work Life Law, amazing advocate, educator. Anytime you have an opportunity to hear these folks, please show up. Sophia Chang, I have had a great pleasure of working with Sophia. She's an organizing coach, an educator, and has also been very involved in the development of our paid family leave training toolkit. Julia Parrish, amazing senior staff attorney at Legal Aid at Work. Just has so much information to share, English and Spanish, amazing advocate again. If you have an opportunity to hear Julia and the team at Legal Aid at Work, do so. You are going to walk out so much informed and with a lot of questions and answers. Mm-hmm. And we have the EDD here, which I mentioned at the very beginning. It's a great opportunity to hear directly from the Employment Development Department. And I'm gonna hand it over to Jenya, who will introduce our speakers for today.
Yes, we're really thrilled to be having the EDD on this webinar because we know a lot of the benefits that you're applying for in the state of California, including unemployment insurance, state disability insurance, paid family leave, all of the main things that we talked to today. The EDD is administering those programs, and we know people here will have a lot of questions for them. And I'm really pleased to introduce Katie Morales, who works with the EDD on these programs and can give you some information about them. We will be talking about UI a little bit later in the program, but this will give you a lot of information about how to connect to the EDD. So Katie, take it away. Thank you very much for being here.
Thank you so much for having us here. Again, as she said, my name is Katie Morales, and we're always excited to be a part of the conversation. I just want to clarify that today I'll be speaking about State Disability Insurance Program, which is a separate branch under EDD from unemployment insurance. As you can imagine, with the COVID crisis, unemployment insurance has been inundated with unemployment insurance claims for normal people who are out, but also for individuals who are self-employed. They're working through the process with the federal government to get benefits available to those individuals as well. So again, because they're inundated, they have pull in all of their resources, even retirees back, they're pulling resources from other branches to make sure that they're mitigating the number of claims coming in insofar as much as they're trying to get a new call center up and things like that. So I did want to reassure you that there are efforts being made as quickly as possible to mitigate the number of claims that are being received on that end. However, today I won't be speaking on UI because I am under a separate branch. Disability insurance is covered under a different section of, or different parts of the California Unemployment Insurance Code, and I can only speak to SDI. Now, I will just provide some general resources for you guys as far as in relation to COVID-19, and you guys, I'll provide you the web resources that you guys can obtain more information as it relates to unemployment insurance. But again, we're so happy, we're thrilled to be a part of these conversations, to connect with you guys in the community who have access to patients and to those who are underserved especially. So I'm going to go ahead and provide you kind of just a general overview of the State Disability Insurance Program today. This isn't designed to make you an expert. Really, I want you to come away feeling like you have a familiarity with the program and you would know how to direct people to which program to use depending on what circumstances they're in. So let's go ahead and get started. State disability insurance is a partial short-term wage replacement insurance plan. It's under Employment Development Department for the California workers and has two components. The two SDI components are similar in that they provide partial wage replacement. However, they differ in what benefits they'll cover. For disability insurance itself, it will pay you benefits if you're unable to work your regular or customary job due to your own illness, injury, or pregnancy. And for paid family leave, it pays benefits if you need time off of work to care for a seriously ill family member or to bond with a new child. I did want to note that SDI does not provide job protections, so the program administers leave benefits only. For more information on your rights and protections during the leave, you can see the California Department of Fair Employment and Housing or the U.S. Department of Labor. So SDI is 100% funded by the California workers. So unlike workers' compensation or unemployment insurance, which are provided and funded by employers, SDI funding is withheld via a mandated payroll deduction for California workers, and it's noted as CASDI on the pay stub. So the program rates are determined yearly and posted annually around October, which will become effective January 1st of the following year. So let's move forward, again, responding to the COVID situation. For Californians covered under California State Disability Insurance or that CASDI tax, benefits have been made available through DI and PFL. If you're affected by the novel coronavirus or COVID-19, if you're unable to work due to having been exposed to COVID-19, which is certified by a medical professional. So if you're under a medical quarantine, you may file for a disability insurance claim. And if you're unable to work because you're caring for an ill or quarantined family member with COVID-19, and that would also be certified by a medical professional, you can file for a PFL claim. If you don't fall in one of these two situations, so if you want to take time off of work, or you need to take time off of work rather, because your child's school is closed and you need to care for your child during this period, that would qualify you under unemployment insurance. More information under what would qualify under DI, PFL, or UI can be found on the websites listed on this slide. The easiest way to access these resources is actually just go to edd.ca.gov, and on our homepage, you'll see the picture of the COVID virus there. You can click on that. It'll redirect you to the pages. From there, you have a lot of information regarding the pandemic unemployment, which is for the self-employed, the additional $600 benefits, And that web page is really kept up to date. So with the most current information that's provided both federally and locally by the state, we update those web pages. So I would just ask that you guys check out those websites. Keep checking in with them because information is changing almost daily at this point. So we want to make sure that you have the resources available to know what benefits that EDD can provide you during this time. So moving forward, I did want to kind of cover the individual components of the program, starting with disability insurance, which provides you partial wage replacement for your own illness, injury, pregnancy, or disability. This can include elective surgery, alcoholism or drug addiction treatment and recovery, pregnancy, childbirth, and postpartum related conditions. You must be under the care of a physician who certifies to the illness, pregnancy, injury, or disability. And DI claims will pay up to 52 weeks per claim. So as long as your doctor is substantiating to the need for treatment for the 52 weeks, EDD will pay benefits. We require a 7-day non-payable waiting period, so your payments will begin on the 8th day of the claim. And you must be experiencing a loss of wages. So this is important. This is something I do like to clarify. We are a wage loss program, meaning that if you're suffering a wage loss, that can be a loss of full wages or just a partial wage loss. As a result of your disability, you may receive benefits from the program. You may work part-time and receive benefits, so it doesn't matter if you're working 8, 6, or 4 hours a day. If you're not working your regular and customary work schedule as a direct result of the disability, then you may be eligible for benefits. And then our wage replacement rate at current is between 60 to 70% of your weekly income, depending on your normal salary. So now that we've kind of given you an overview of disability, I'll move to an overview of paid family leave. So if you're covered by DI, you'll automatically be covered under PFL as well because they're both part of the California State Disability Fund that you would pay into with that CA-SDI tax. PFL provides up to 6 weeks of paid leave in a 12-month period. So whereas DI will pay 52 weeks per claim or per incident, paid family leave actually pays 6 weeks in a 12-month rolling period, meaning if you began your claim on June 1st of 2020, you would have 6 weeks all the way through May 31st of 2021, and you wouldn't be able to apply for an additional benefit period until June 1st of 2021. Just to note, as of July 1st, 2020, so for all claims with a start date of July 1st, 2020 or after, benefits will increase to 8 weeks in duration. So we are working, the governor is really excited about the paid family leave program. We're seeing a lot of even just feedback nationally from the paid family leave program, especially during this this kind of crisis that we're in. And we are working with the governor, with the legislator. The PFL advocates have been a wonderful resource to get this number increased. So they were pushing a big push in getting us up to the 8 weeks. And so we'll see what we can expect in the future as far as additional expansions. Paid family leave can be used to bond with a new child entering your family or to care for a seriously ill family member. And new children entering the family isn't limited to the birth of a new child. It could also be children who are entering the family through foster care placement and or adoption. So you will use your benefits within 1 year of the child entering the family. We'll discuss a little bit more about that in detail. Paid family leave does not need to be taken all at once. You can split your time up, you can use it intermittently, or you can use it while you're working part-time. And unlike disability insurance, paid family leave has no waiting period, so payments will begin on the first day of your claim. We also want to reiterate that this is not a government assistance program. So we know that you guys working in communities that don't have access to information as readily, there are a lot of people who aren't applying for the program because they see it as a government assistance or government handout, and it's absolutely not. It's something that the California worker pays into. And just like you would pay into your car insurance, if you needed it, you would utilize the insurance. So we want to make sure that we're really enforcing the message that that this is not government assistance. This is something that they've paid into, and this is fully accessible to them. We also, just to note, do not take immigration or citizenship status into account as other programs do. We do not ask any questions regarding their status. So we'd like to pass that and kind of enforce that message on as well. Let's move forward. Again, we talked about there being 2 types of paid family leave claims. We have care claims and bonding claims. And today I'm going to go ahead and start with family leave care claims. So if you're taking a paid family leave care claim, you may take time off of work to care for a seriously ill child, parent, parent-in-law, grandparent, grandchild, sibling, spouse, or registered domestic partner. And if we can move the slide forward. Now, paid family leave includes out-of-state care. So if you have a family member who you need to care for who's out of state or out of the country, you will maintain eligibility for the program. In order to provide care in these situations, the physician or practitioner must provide certification of the serious illness and the need for care. The care recipient or their authorized representative, if they're unable to sign, must provide a signature confirming that there is a request for care. And we wanted to let you know that more than one family member can file a claim for each care recipient. If that care recipient requires 24 hours care, we understand that that might take 3 people, as they might each do an 8-hour shift to care for the family member. So up to 3 individuals can file a paid family leave claim for each care recipient. In addition to providing benefits to caretakers, PFL also offers benefits to parents taking time off to bond with their new children entering the family. So let's go to the next slide and we'll talk about bonding benefits. New mothers, fathers, adoptive parents, and foster parents are eligible for bonding benefits. This benefit allows any new parent to spend time with their baby or their new child entering the family through birth, adoption, or foster care placement. These benefits must be used within the first year of the child entering the family, meaning if the child is born on June 1st, 2020, you'll have until May 31st of 2021 to claim the benefit weeks. If the child is entering the family through adoption or foster care placement, you'll have 1 year from the date that the minor child, and I do emphasize it has to be a child under the age of 18, enters the family. So you'll have 1 year from that date of placement. Bonding claims do require documentation showing the proof of relationship, which can be a birth certificate, a birth record, or foster adoptive placement agreements. For newborn babies, it does take time for a birth certificate to be registered with the county register. We understand that, so we do accept birth records, which are the unofficial records provided by the hospital, and they can be used to verify the bonding claim. Bonding benefits can be used by both parents at the same time, so they can use them concurrently, or they can use them separately at different times, so long as it's within that 12-month rolling period. And let's talk about transitional bonding. So new mothers, those who are pregnant, may claim disability insurance benefits. Now, on a standard pregnancy, that is typically 4 weeks prior to the due date, and then after delivery, they're eligible for up to 6 weeks to recover from a normal birth or 8 weeks to recover from a cesarean section. Now, these benefits may be extended beyond these standard weeks as if there are pregnancy or postpartum complications. And I want to talk, kind of harken back to the COVID conversation. If an individual is pregnant and their doctor feels that in the workplace they may be at risk to be exposed to COVID-19, as that can be considered a pregnancy complication. So as long as the doctor is substantiating medically there is a need for that individual to be off work, they may extend their that pregnancy benefits beyond the normal 4 weeks, even under a situation like COVID-19. So the medical provider will need to provide certification for complications to the EDD to allow for the additional time, whether that's a pregnancy complication or a postpartum complication. Now, new moms receiving benefits after giving birth are most likely eligible to receive PFL benefits after their DI claim ends. A claim for paid family leave benefits new mother, which is a single form application, will be issued automatically after their final DI payment. And the form must be submitted to file for PFL benefits. So it doesn't happen automatically. If they're transitioning from a DI pregnancy-related claim, they will need to go ahead and file the paperwork to claim their PFL bonding benefits. And then if they're transitioning from a DI pregnancy-related claim, they will not need proof of relationship as a normal bonding claim would, because their DI claim in and of itself is proof of the bonding relationship. So we'll talk a little bit more about determining eligibility, just a brief overview. If you've paid or if your client has paid into the California SDI tax, which they can see on their W-2 and or their pay stubs as CA-SDI within the 5 to 18-month period prior to taking their leave, then they're most likely eligible for benefits. Not all employees pay into the program, so it is important, and we do want to emphasize, to check a pay stub before assuming eligibility. Again, we want to note that citizenship and immigration status do not affect eligibility. And we also want to just let you know that benefits are not guaranteed until the claim is approved by the EDD. If anyone is unsure about it and they're kind of saying, well, would I qualify or not, please have them apply. We want to let people know that to not disqualify themselves. We want them to know that we're the ones who are trained under the law to make a determination on the claim, and we don't want anyone preventing themselves from even applying if they thought, I'm going to be disqualified anyways. At the EDD SDI, in-state disability insurance, we pride ourselves in the fact that we understand we're working on behalf of the constituent. We understand we're working on behalf of the claimant, and we want to pay the claim. And we are, the way that we interpret the law is always to benefit the claimant. And so we will do everything in our power, so long as we are under the code, the CUIC, we will do everything in our power to pay the claim. So please, if they're unsure about it, if they're questioning if they should or not, have them file the claim and allow us to make the determination. So let's move forward and talk about employment status. So how does employment status impact eligibility? Well, you don't have to be a full-time employee to qualify. It can be seasonal, part-time, or even unemployed, and they may still qualify. If individuals are unemployed, they must be either collecting unemployment insurance or be actively looking for work to qualify. Since eligibility is determined by employment contributions 5 to 18 months prior to the claim start date, the current employment or lack of employment doesn't necessarily disqualify an individual. For self-employed individuals, eligibility is available if they're making contributions to the disability insurance elective coverage program. For more information on how to enroll, you can visit the EDD site, and they can get you started on your contributions to SDI. Now that I've given you a brief overview of the program, we really want to talk about how to apply, right? So let's get into the claim filing process. There are 2 ways to apply for DI and PFL. We'll go ahead and move forward to the next claim to talk about that. It is recommended to file a claim through SDI Online, as this is the fastest and easiest way to submit claims. It reduces claim errors, processing time, and really you have all the benefits of being able to contact EDD online, as well as view your claim status. So in order to file a claim online, you must be registered for our new single login portal, which is called Benefit Programs Online. That gives you access to SDI Online and UI Online. You'll need to then register for SDI Online and then select File a New Claim in SDI Online. Tutorials are available that give you a complete walkthrough for registration and claim filing on the EDD website, edd.ca.gov, and you can access those on the BPO or Benefit Programs Online site. If you prefer to file by mail, you'll need to complete the claim for disability insurance benefits, or DE 2501, or the claim for paid family leave benefits, DE 2501F. Claim forms must be completed in their entirety, and all required supporting documentations must be returned to the department for claims processing. It is important, if you're completing a DI form by mail, that you are using the red image on the slide. So you'll see that as an optical character recognition. It interfaces with SDI Online, and essentially that means that it reads the document for us and then inputs the information, as opposed to having to manually type in each document. So we ask that you use the correct forms when you're completing your application, and that you don't skip any questions. Even if the question you don't feel pertains to your situation, we do need an answer on it. Any questions that are left blank or unanswered do require additional investigation, which means we have to contact the appropriate parties to obtain the information, which can delay claims processing or cause disqualifications if we're unable to reach the appropriate party and obtain the information. So again, if you see a question that doesn't pertain to you, go ahead and answer the question anyways, just mark no, and we'll go ahead, that'll make it a lot easier on our end to get you paid as quickly as possible. Now, whether claims are filed online or by mail, there is a timeliness period. For disability insurance, you have to file within 49 days of the requested start date. And for paid family leave, you need to file within 41 days of the requested start date. So let's move forward. And I'm going to discuss SDI Online first. Again, this is the recommended way to file your claim. So filing with SDI Online expedites your claim, reduces paperwork, it saves you time, really. It also greatly enhances the efficiency of the services provided to you. Users must complete a one-time registration, again, through Benefit Programs Online, and then access SDI Online. To file online, log in, select SDI Online, and then select New Claim to begin your application. Our new web template is fully responsive. It provides full access to your claim, even from your mobile device. So if you're using your mobile device, you can view your SDI Online account, check your inbox, and file a new claim. So let's talk about filing paper forms. So for filing a disability insurance claim, you'll use the DE 2501, and you're going to go ahead as the claimant portion is 1 through 4. You're going to fill that out and make sure that it is signed and that all of the questions are filled out completely in their entirety. You want to make sure that if you're going to be indicating what your employer's work address is, that you speak with your employer about what address they want forms sent to so that you have the appropriate form and it doesn't get kind of lost or delayed in the mail. So no questions should be skipped or left answered. And again, a signature is important on that form. Pages 5 through 7 will be filled out by the physician. And again, we recommend that you just double check the physician hasn't skipped any questions and that they have their signature, their original signature, not a stamp on page 7. If you're filing for a paid family leave claim, you would be using the form DE 2501F. And that form you'll again need to complete in its entirety. However, we do want to be mindful of the type of claim you're filing. If you're filing for a care claim, you will need to complete Part A. Page 2 will need to be signed by the individual receiving care. Part C will also need to be signed by the care recipient. And Part D will need to be completed by the physician or the practitioner of the care recipient. For bonding claims, which is on the following slide, you'll need to complete Parts A and Part B, as well as providing the supplementary or supporting documentation to verify the relationship. This could be, again, a copy of the child's birth certificate, a birth record, or a foster adoptive placement agreement. And then we also wanted to show you the transitional bonding. This is the one-page application on the following slide. This is for new and expecting mothers. So if you filed your DI claim by mail, you'll receive this after the final payment by mail. If you filed online, you'll receive this electronically on your SDI Online account. Now, again, you do need to complete this form in order to access your additional bonding benefits. So you complete this one-page form. Supporting documentation is not required when you're returning this form, as your DI claim will verify the relationship. So what do you do after you filed your claim? A properly completed claim takes typically up to 2 weeks. So we have 14 days by law to process the claim with either a payment or a notice as to why the claim has not been processed or qualified. The EDD will mail you a notice of computation, or DE 429D, and that informs you that your claim was received and what your estimated benefit amount is should your claim be accepted and paid. You'll know your claim has been approved once you receive an electronic benefit payment notification. And if more information is needed in order to process your claim, EDD staff will contact you directly, either by phone or mail. Once the claim has been processed and benefits have been paid, you'll receive an EDD debit card and or check, which you will select what your preference is when you're applying for a claim. Let's move to the next slide. We'll talk a little bit more about payment options. So you now have the option to select how you receive your benefit payment when you file a DI or PFL claim. The EDD issues benefit payments via the EDD debit card through Bank of America or by check, which is mailed to you from EDD. You do not have to accept the EDD debit card if you choose not to. However, we do recommend it, as once you have the card, benefit payments are issued to you on the card within 1 to 2 days after we qualify your claim. Every time you qualify a claim under a check, you just have to note that there's going to be additional time for mailing the check out to you, which can be 5 to 7 business days. Benefits of the debit card also include secure payment process, improved service and efficiency through Bank of America. You can use them anywhere a Visa is accepted, at ATMs or point of sale terminals. If there's cost savings on check printing and postage, and it also reduces your security risks associated with a lost or stolen check. So it helps prevent fraudulent activity. You're able to sign up for notifications either through email or text messages to alert you when there are changes to your account, including low balance, or if you need a daily balance, they can provide that to you as well. If you prefer a check, you can always select the check option. Again, just note that an additional mailing time will be required to receive payment. For more information on disability insurance or paid family leave, you can visit our website at edd.ca.gov/disability or californiapaidfamilyleave.com. You can contact the EDD at one of the toll-free numbers provided as well. Information is available in English and Spanish for DI. For paid family leave, we have multiple languages: English, Spanish, Cantonese, Mandarin, Vietnamese, Armenian, Punjabi, and Tagalog. For additional services in additional languages, you can refer to the EDD website on our Contact SDI homepage. With that, we're going to go ahead and I'm going to turn it back over. I know if there's questions, you can go ahead and direct them to the Q&A portion or in the chat pod as well. Alejandra?
Thank you so much. Wow, that was great. That was very clear. I know I had a lot of my questions answered. Let's see, help me out, panelists. Yes, while we are sorting through the questions, if you wouldn't mind, if you have a question that has not been answered, please go into the Q&A section. It's just in your panel, in your floating panel with the buttons, and click on Q&A and add it in so we don't lose those questions and the EDD can respond to that. We have a question of if your EDD trainings are available in another language. Katie?
Sorry, can you hear me?
Yeah, I can hear you now.
Okay. So we do have training available in Spanish when we have Spanish representatives available. So we have designated individuals in the state of California who can offer Spanish presentations. However, because of the current crisis that we're under, we have all of our resources pooled either to assist with unemployment insurance and processing their abundance of claims, or being rerouted to our department to process claims as well. So at current, we do have our English available. I know that for the seminar that we're having today at 1 p.m., that the coalition is graciously providing translating services for us there. However, normally, yes, we do have individuals that we can reach out to that do attend events. If you guys are hosting an event and want a Spanish speaking available, we do have individuals in the field offices that will represent us in Spanish.
Thank you. Katie, you can also follow along with me in the Q&A section of your floating panel. We have a question: if a non-citizen applies for SDI and enters a Social Security number, and if they get a letter stating that they do not have benefits, can they reapply without putting a Social Security number? Would they just submit a copy of check stub and W-2?
So reapplying is actually not necessary. What they'll do is they'll take the notice that was received from EDD and they'll go ahead and submit the W-2 with that notice back to the address that's listed for an appeal. So they can contest that notice saying, yes, I do show that I have a record via W-2. They can provide the W-2 and or pay stubs back to the EDD. And what we'll do is we'll go ahead and have the tax branch add those wages back into their profile so that we can reestablish that same claim. So it's not necessary for them to file a new claim. They just need to provide the information with wages so that we can go ahead and submit that for adding to their bank.
Thank you so much. If an undocumented person applies for paid family leave or SDI, will this categorize them into under the public charge law?
We do not request any information, nor do we provide any information to any other entity regarding citizenship. We won't even ask the question. There's nowhere in our paperwork that requires any citizenship or immigration status to be filled out. So long as you have been paying into the SDI program via that CASDI, that is the only, as far as eligibility terms regarding their wages or Social Security number, we're just looking to see that they paid into the program. So no, we won't be even asking the information of them.
Thank you so much. I think this is the last question. would the medical provider from another country be the one to sign the paid family leave application?
Whomever the medical provider is for the care recipient. So if they are out of country, they will need to provide, they'll need to bring with them the paper application and have the medical provider in the country of care that they're going to fill out that information and then return it. Now, again, because it's an out of country, they need to probably anticipate that there's going to be a greater mailing time, as well as there probably will need to be an in-house investigation to ensure the validity of the doctor's license. However, we will accept out of country doctors, so please have the medical professional who's caring for the care recipient complete those documents.
Okay. Katie, thank you so much. It has been a pleasure having you here. You answered so many of our questions, very clear information. We really appreciate you. We appreciate working in partnership with you all. And we look forward to continuing the conversation with the EDD. Any other questions, panelists? Anything else I'm missing? All right. It looks like I may be dealing with a little connection issue. So while we get that set up, we're going to be moving over to our next speaker. So give me 1 second. Thank you so much, EDD. Now we are on to Juliana Franco, attorney. I'm so excited to hear from you. I've got my notepad ready to go. Thank you so much. It's all yours.
Well, good morning, everyone. Thank you for being here with us on this beautiful Wednesday morning. I'm sure many of you attended last week's webinar. We did give an overview of existing laws in California and kind of information on your rights and when a certain law may come into play. So just an overview, because this is a very important point in this area of law, is that certain laws provide your right to job protected time off, while others provide the right to income replacement. Just because you're eligible for one does not necessarily mean you're eligible for the other, and vice versa. That's a very key point to remember when we're having these discussions. So for example, if someone's taking leave for pregnancy disability, that doesn't necessarily mean that they're eligible for the income replacement and vice versa. Now I'm going to go into pregnancy disability and other steps that you can take to ensure your rights. So to access your rights, you might have to communicate with different entities. For some, you may need to talk to your doctor and your employer, and for others, you may need to talk to the EDD, your doctor, your employer, and a combination of those entities. Sometimes these interactions can be very stressful. So what I'm going to do today is give you some tips on how to communicate with your employer and tips for your doctor on how to communicate with your employer and what goes into an effective note. As many of you may know, disclosing a pregnancy to your employer can be really stressful, especially so if you're unsure of your rights, how to access them, or if you have reason to believe that your employer will react badly. So we've put together some tips to make this process easier. Remember, you don't need a doctor's note in order to disclose your pregnancy. You may need one later, but having this initial disclosure with your employer, it's not necessary to have one. So first of all, it helps to be informed. Review your employer's policies about pregnancy and parental leave. It may also be helpful to get an idea of what the laws are that protect you. We're here to provide you that information. Also, having this conversation, it may help to reassure your boss that you're committed to your job and you plan to return. Sometimes, due to stereotypes, some bosses may think that someone's not planning on returning to work. That's not always right. So sometimes it helps to make that statement affirmatively. Yes, I will continue working after I come back from leave. Also, it might help to come up with a plan for your leave. For example, if you're in a job where you oversee people, it may help to have a transition plan or plan to bring in someone else. This is not always necessary, but it can help you feel better, and it can help your employer feel more prepared for your leave. This is a collaborative process that you have to go through, though. Don't think that this all falls on you. Your employer needs to be involved too. During any conversations with your employer, feel free to take notes, especially if something sounds strange or wrong to you. You want to be able to go back and double check things. And if something was just wrong, you may want to have that for later if you decide to talk to an attorney. Also, if any promises are made during these conversations, it does help to follow up, with a note or an email thanking your employer for agreeing to your leave from a certain date to a certain date. Documentation does help, and we do have a sample note for you later in this presentation. And remember, it is illegal to treat someone differently because they are pregnant. So your employer can't fire you because of that and can't treat you worse. If you ever are in a situation where you're unsure if you're being discriminated against, please reach out to a counselor. So this is a really great sample letter from Legal Aid at Work on how to put your request for pregnancy disability leave in writing to your employer. Like I said, sometimes this really helps you feel more comfortable, and it also clearly spells out your rights for your employer, whether they are aware of it, of your rights or not. It can really help them know what you are entitled to and know that you're serious. Also, it's really important for you to know that you don't have to disclose your diagnosis if you do have a certain pregnancy-related condition. All you need to say is that you're disabled by pregnancy, childbirth, or a related medical condition, or you will be. Make sure to give the anticipated dates of your leave, though. It's best practice to give your employer about 30 days notice of leave if it's foreseeable. If it's not, just give notice as soon as you can. Sometimes your employer might request a note from your healthcare provider. This isn't the only time your healthcare provider will be involved in these conversations. Your healthcare provider will also need to certify for your EDD benefits, such as SDI. And well-meaning doctors provide notes all the time. Sometimes they can cause problems. So Center for Work-Life Law and other organizations such as Legal Aid at Work have provided doctor's note guidelines to make this process a little easier for them. A supporting letter should include, specifically for leave, should include that the patient is disabled due to pregnancy, childbirth, lactation, or related medical condition, that the patient requires full-time leave, a reduced work schedule, or leave from medical appointments. Now, if your patient is able to continue working, say that in the note. Also, provide the dates of the anticipated leave or an anticipated schedule or reduced schedule. It's really important to provide at least an estimated date of when the patient can return to work. Otherwise, the patient can run the risk of losing their job. Again, we have these really great sample letters from Legal Aid at Work, and Work-Life Law also has some samples for healthcare providers to write notes to their patients' employers. As you'll see, there are templates that provide so many options for the doctors. It really shouldn't take that much time away from their already really busy schedules. It's important that you let your doctor know that no, they don't need to disclose your diagnosis so long as they provide that really critical piece of information that you're disabled by pregnancy, childbirth, or related medical condition, and it's always good to provide the expected dates of leave. So while someone's on pregnancy disability leave, they can apply for state disability insurance, as our colleague from EDD explained earlier today. To be eligible, they need to meet certain criteria as listed on the slide. And it's really, we want to stress that this is available regardless of immigration status. There are certain ways that you can apply for the benefit. And if someone has help, please feel free to contact a helpline for guidance through this process. Now I'm going to hand it off to my colleague, Julia Parrish from Legal Aid at Work.
Thanks, Juliana. We're going to go through this really briefly, and I just want to stress for folks, one of the major takeaways that we're hoping that people get from this webinar is the sort of annoying legal intricacies of the way that we talk about paid family leave. So we know that paid family leave is a term that we use in conversation to mean paid time off, which can mean a whole lot of things. But legally speaking, if you're talking about protecting your rights, job protected laws are different and separate, and they have a whole separate set of requirements. And then wage replacement laws are the sort of programs that the EDD Representative Katie was talking about. So just to keep in mind that those are separate and that paid family leave can sort of go by a number of different names. You know, we have disability insurance, there's paid family leave, there's, you know, bonding leave and pregnancy leave. So I just encourage folks to look at the other webinar for the details of that. But one takeaway is that there are many laws that provide people with up to 12 weeks of job protected time off. Job protected meaning you can return to your same position or a comparable position to the one you had before you took your leave. And there are 3 reasons that you can qualify, either to bond with a new child within 1 year of the child's birth or placement in your home, to care for a seriously ill family member, or to care for your own serious health condition. And the same tips that Juliana just went over in terms of talking to your employer for common sense. Write notes, keep a record, ask to see policies. It's your right to investigate what you're entitled to, and I know that that can be really intimidating. So please refer to the tools Juliana talked about if you need help. And in terms of certifications that employees can be required to provide for employers when they ask for this type of leave, if you're asking for leave for your own health condition under the Family and Medical Leave Act or the California version, the California Family Rights Act, then the note really needs to have your name, date, and then the expected duration of your leave. As Juliana talked about, there are privacy protections in California that protect people from having to disclose what their particular diagnosis is. You do have to disclose enough information to indicate that you have a qualifying serious health condition. And then information that the employer will need, which is basically the anticipated dates of your leave. And we all understand that this is an estimate and that people's medical treatment plans change and recovery times vary. So it is contemplated under the law that you may have to update this information at some point. So don't feel like you're totally locked in to the dates given in these. If there is some sort of change, then you give new information to your employer with new dates. And again, for your own health condition, if you are asking for an intermittent leave or a reduced schedule as opposed to one big chunk of time, you also want to include your estimates of how that leave is going to work. Is it going to be 1 week every month for cancer treatment, or is it 1 day a week to attend therapy appointments? And then again, this is an estimate, it's your best guess. If you have an intermittent condition that's episodic, like migraines, that's hard to guess, but you just have to do your best and give your employer some information so that they can estimate the time off. And there's a difference in if you're providing a certification to care for someone else's health condition. So the previous 2 slides were about your own health condition and your needs for medical treatment. There are even stronger protections in California if you're referring to someone else's health condition. So basically you need to just explain what the patient's name, and again, this is the certification that the healthcare provider is providing, the patient's name, and that they need the assistance of the family member who is going to provide care. And when we're talking about providing care for a seriously ill family member, a lot of people sometimes assume that that means administering or doing injections. And it's actually much broader than that, right? It's going to the grocery store for them and cooking meals and, you know, putting gas in the car to take them to appointments, including arranging care for someone else. If you're going to have a skilled nurse or go to a facility, that takes time off to sort of arrange for those things to happen. And it can also include psychological comfort and care. So I just want to make sure that people understand that this isn't like, you know, medical professionals providing care. It's the kind of care that we can provide for our family members who need it. And the note doesn't need to specify what kind of care it is. So now I'm going to hand it off to Sophia to talk about local and state paid sick days.
Thanks, Julia. So folks will notice that this is called sick days and safe days. And one reason for that is that a little known fact about paid sick days in California is that you can actually use them if you are a survivor of domestic violence as well. So all California workers working 30 or more days within a year in California must be given a minimum of 3 paid sick days. The reason why it's a minimum is depending on where you work in the state. So for example, if you work in Emeryville, Oakland, Los Angeles, San Francisco, a bunch of other municipalities in the state, you may actually have local laws that are stronger so you can accrue more paid sick days. You can use paid sick days to care for your own illness or to care for a family member. And you actually don't have to be sick to use this time. You can also use it for preventative care. So for example, if you have well child, well baby checkups or vaccinations, you can use the time for that. And like I mentioned before, the reason why we use the term safe day is because you can use this time off to also seek care services related to domestic violence, sexual assault, or stalking. Important information about paid sick days and paid safe days. Your employer cannot deny a valid request for using this time off as long as you've actually accrued it. You don't need to explain or justify why you're using it. So similar to the short-term disability insurance, you don't need to go into detail about your reasons. You should let your employer know as soon as you can. So for example, if you're using your time off for a well baby checkup, that's something that's obviously scheduled ahead of time, so you could give your employer a heads up. But sometimes you wake up in the morning and you realize you're super sick and you can't go in, so you can let your employer know that morning. Your employer cannot create rules saying like, oh, you can only take this time off if you let me know, for example, 3 days ahead of time. This is really important, especially for folks in the service industry. Your employer cannot require you to find someone to cover your shift as a condition of using the leave. As a manager, as an employer, that's their responsibility. So that cannot be a requirement or prerequisite for you to use this paid sick or paid safe time off. And also, this is super important, and a lot of people don't know this, your employer cannot require documentation. So sometimes employers will say, okay, well, you can use that time, but you have to give me a doctor's note. They actually cannot require this unless you are taking 3 or more paid sick days consecutively. In that case, if you're taking 3 or more in a row, then they can ask for documentation. You also don't need to use the entire day. So if you are going to a doctor's appointment and you know that it's only going to take up, let's say, 2 hours of the day, you can ask your employer, can I use 2 hours or 3 hours that I've accrued? Your employer cannot require you to use up like a whole day of accrued time. So some good practices. Find out what your employer's established policy is for requesting and using paid sick day. If they don't have a written policy, it's really important that you document your request in writing. So if you have a habit of texting or emailing your employer, it's really important to have that paper trail and specify the day and the amount of time that you're going to take off. And this documentation is important to keep a good, clear line of communication with your supervisor, and is also helpful in case there's misunderstanding in the future, in case there's any retaliation, in case you get your next paycheck and you find that you weren't paid for that paid sick time. You can refer back to your email or the text message and say, hey, remember I had accrued this time. I let you know, I gave you a heads up that I was going to take it, and this should be showing up on my next paycheck. So we're going to skip this part, just this one slide, but an important part of knowing your rights is that if you run into any trouble, for example, you think that you've been retaliated against, maybe your employer decides that, oh, you know what, this person's taking too much time off, paid sick time or paid safe time, I'm going to cut their hours. I'm going to give them a less desirable shift at work, demotes you, threaten you, for whatever reason, you have recourse. So one of the things you can do is you can file a retaliation claim with the state of California. And the good thing about the coalition that's providing this training is that there are a bunch of different organizations, including legal aid organizations, nonprofit worker centers that are industry specific that can help you navigate that. And again, if you think just as a preventative thing, in case you experience retaliation, it's always important to document your requests in writing so that you have a paper trail. Great. So we developed a checklist to help individuals navigating paid leave, specifically paid sick days, paid safe days, and paid family leave, as well as service providers, for example, nurses, counselors, people who might be helping folks navigate their right to leave. So the checklist is made of 5 super simple questions. Here's the first question. Why are you using the time off? So are you using it for baby bonding? So as the EDD pointed out, the baby bonding doesn't have to be with a baby that's your biological child. It can also be somebody who you're taking into foster care or someone you're adopting. Are you caring for a seriously ill child, parent, parent-in-law, grandparent, grandchild, sibling, spouse, or registered domestic partner? Because for the paid family leave, there's a defined scope for what counts as family member. Are you taking care of your own or a family member's health for 3 or fewer days? Or are you seeking care or services related to domestic violence, sexual assault, or stalking? So any of these would qualify you to use paid family leave, or for the second to last one, taking care of your own or family member's health for 3 or fewer days. You could use paid sick leave for that. The second question is, what city do you work in? So the reason why it's important to know what city you work in is because, like we mentioned before, there are certain cities in California where you can accrue more than 3 paid sick days. How long have you worked there? How many hours did you work at this workplace in the past 12 months? That can be approximate. And then how many employees does your company have in a 75-mile radius? And so what these questions are getting at, numbers 3, 4, and 5, is the job protection. Because for a lot of us, when we're considering whether or not we're going to take paid family leave, a question that may be looming is, okay, so I'm going to take paid family leave. I'll have some partial income for 6 weeks, but will I have a job guaranteed to go back to? So these questions help you think through under the law what kind of protections you qualify for. And if you're a service provider and you want to help people, your clients, your members, your patients navigate some of this, here are some suggested questions that you could ask them. So if you're helping someone with prenatal care, or you're working with a family that you know has a child coming, you can ask, hey, are you planning to take time off when the baby's born or when the adopted child or foster child arrives? You could ask them, hey, did you know that you might qualify for paid family leave? So you could have 60 or 70% of your income for up to 6 weeks while you bond with this child. And as of July 2020, it's going to be up to 8 weeks. You could also ask, do you have any idea when you might return to work? Have you talked to your supervisor about it? You might qualify for job protection. Job protection means that after your leave, you come back to your same or comparable job. And it also means, it's super important, that you keep your benefits while you're on your leave. And you can review the paid leave checklist, those 5 simple questions that we had just reviewed a second ago. So this is for caregivers. You could ask the caregiver, so this might be someone who is accompanying the patient to doctor's appointments. How has caregiving been affecting your ability to work? Have you had to take time off from work because of your responsibilities? Do you think in the future you might take more time off because of your caregiving? And this is just, I've been a caregiver, this is just a way for caregivers to start really thinking through the time that they have already been taking off, the time that they might take off in the future, and to consider whether or not they qualify for paid family leave for caregiving, and whether or not they want to put in a claim because they anticipate that they're going to be taking more time off and they still need that income. So more questions about caregiving, and this gets at the job protection. Have you talked to your supervisor about it? You might qualify for job protection. And again, the job protection depends on how long you've worked there, how many hours you've worked there, and the size of your employer. This is about paid sick days. So paid sick days, the time frame that you use paid sick days is usually a shorter time frame. Again, paid family leave is for, excuse me. Thanks, everyone. This is the joys of working from home. Okay. So paid sick days is usually a shorter time frame. Paid family leave is to take care of someone who's seriously ill. So paid sick days. If you're talking to a worker, you could ask, when you're sick, do you usually go to work or stay home? Did you know that you qualify for paid sick days? This means you can stay home and still be paid your regular pay. And for paid family leave, you qualify if you pay into SDI, which you can check if you look at your paycheck. But for paid sick days, everybody accrues paid sick days in California if you work in California. And this is true regardless of whether you're part-time, if you're paid hourly, the type of business. So I've talked to workers who say, oh no, I work for this really small mom and pop business, I don't qualify for paid sick days. Not true. Still qualify for accrual, and it's regardless of immigration status. So we're going to talk about one person's story as a case study, and this is a person named Cam. So there is a young man named Cam. His partner is pregnant and they are expecting their first child. He's a college student and also has worked as a bartender for the past 3 years, about 25 hours a week. He's working as a part-time bartender. He's meeting with his school counselor to understand his options for parental leave. So let's go through the 5 questions in the checklist so that Cam can start to gather the information to think through what he qualifies for. So why is Cam going to use this time off? It is to bond with a child born within the past 12 months, right? This is his newborn kid. What city does he work in Fresno? He's worked at his workplace for 3 years. And if he worked about 25 hours a week, and maybe he took 1 week off around Christmas time for vacation, he worked about 1,275 hours. Again, it doesn't have to be exact, it's just an estimate. And how many employees does the company have? About 80. So according to this, Cam can take up to 6 weeks of paid family leave. He gets that wage replacement because when he checked his paycheck, he saw that there were SDI deductions, so he knew that he was paying into the fund. The second question is, does he qualify for job protection? So this means if he takes some of the time off, he might not take up the whole 6 weeks, but let's say he takes 3 weeks or 4 weeks. Will his job be guaranteed when he comes back? Yes, he qualifies for job protection because he's been working at the same place for over a year, more than 1,250 hours in the last year, and the employer has more than 25 employees. I think this might be a typo. I think it might be 20 employees. Maybe one of the attorneys can clarify in the chat. But basically for the job protection, you just look at how long you've been there, how many hours you worked, and the size of the employer. I think because we're running out of time, we're going to skip the next story, but there's a final story at the very, very end. Yeah, thank you.
Hello, everyone. It's me again. So I'm going to talk to you today about some new worker protections under the recently enacted Family First Coronavirus Response Act. Just to be clear, this is a federal law, not a California law, but it does provide some additional rights to workers in California. If you work in certain cities around the state, for example, San Jose or San Francisco, you might have even more rights. I know certain cities have been trying to pass ordinances that fill in some loopholes in those laws and ensure that more workers are able to access these protections. So the Families First Coronavirus Response Act did two pretty major things. It provided for emergency paid sick leave and emergency family medical leave. Now these are temporary and go through the end of the year, but they have raised a lot of questions for people, so we're here to answer some of them. So we're going to start with emergency paid sick leave. One important thing to note is that this doesn't have a time and service requirement, meaning that you don't have to have worked somewhere for a set amount of time before you qualify for it. You're also going to request this from your employer. So some of the tips here are going to be about talking to your employer, but also about information that you need to provide your employer. So first of all, you get 2 weeks of paid sick leave at 100% wage replacement if you're under a quarantine or isolation order from a government entity, or if you have been advised to self-quarantine by a healthcare provider. Now, the maximum daily amount you can receive while taking this type of leave is $511 per day, or $5,100 total over the paid sick period, which is 2 weeks. Now, you can also take 2 weeks of paid sick leave at 2/3 your wage replacement if you're caring for someone who's subject to a quarantine or isolation order, who's been ordered to self-quarantine by a doctor, or if you're caring for a child whose school or childcare has closed. Now this has a maximum of $200 per day or $2,000 over the paid sick period. Remember, this entitlement is only 2 weeks of paid sick leave. So you can't take 2 weeks per qualifying reason, it's 2 weeks total. Next slide, please. Yes, so in order to apply for the paid sick leave from your employer, you're going to need to submit a signed statement and provide notice as soon as practicable. This is a legal term, but just provide notice as soon as you can. Meaning if you are sick and spoke to a doctor, try to talk to your employer as soon as possible. If you receive notice that your child's school is closing, which has already happened, but let's say for some reason it hasn't. Provide notice to your employer as soon as you can. Try to follow their notice procedures, whether it be oral or written, but for purposes of this note, some DOL regulations do recommend a signed statement. This should include your name, the dates for which you're requesting leave, your qualifying reason for leave related to coronavirus, and an oral or written statement that you're unable to work or telework for one of the following reasons. And these are the qualifying reasons for taking emergency paid sick leave under the Families First Coronavirus Response Act. So one reason is that you yourself are under a quarantine or isolation order from a government entity. You'll also need to tell your employer the name of the government entity that issued that order. Another reason is that you have been advised by a healthcare provider to self-quarantine. You'll need to provide your employer the name of that healthcare provider. Now, if you are caring for an individual subject to a quarantine or isolation order, you need to provide the name of that government entity that issued the order or the healthcare provider that recommended the self-quarantine. There are a few more requirements if you're caring for a child whose school or childcare closed. For instance, you'll have to provide the name of the child that you're caring for, the name of the school or their childcare provider that closed or is unavailable, and a statement representing that no other suitable person can care for the child during this period of requested leave. There is another form of eligibility for paid sick leave under the Families First Coronavirus Response Act, and that's if you're experiencing what's called a substantially similar condition as specified by the Secretary of Health and Human Services. Now, there isn't much guidance on this yet, so most people will be taking it for the earlier 4 reasons that we mentioned. It's important to know that if you provide notice to your employer, they need to give you the opportunity to correct before they reject your request for leave, and your employer must keep the documentation that you provide for 4 years. Remember, you're requesting the permission for the time off from your employer, but your employer will also be responsible for paying you during this time. They will eventually receive a tax credit, which is why this information is important for them. Now, so after you've taken 2 weeks of paid sick leave, you might need more time off. Now, there is an additional 10 weeks of leave under the Families First Coronavirus Response Act for childcare or school closures. It doesn't extend to the other qualifying reasons under paid sick leave. This is an expansion of the FMLA, and it does provide pay, 2/3 of your wages for the additional 10 weeks while you're unable to work or telework due to these closures. It's a shorter time and service requirement than the FMLA. Instead of having to have worked at your employer for at least 12 months, you only need to have worked there for 30 days. It's important to know that your FMLA entitlement hasn't expanded with this. It's still just 12 weeks total. So for people who are planning on taking FMLA later in the year for another reason, keep in mind the possibility of exhaustion. And this also can't be used to cover a reduction in hours that has already happened. So again, you're going to want to request this from your employer with similar documentation that you would have used for the Emergency Paid Sick Leave Act. You're going to want to submit a signed statement that includes your name, the dates for which you're requesting leave, your qualifying reason for leave, and a statement that you're unable to work or telework because you're caring for a child whose school or childcare provider closed or is unavailable. You need to provide the name of the child you're caring for, the name of the school or childcare provider that has closed, and a statement saying that no other suitable person can care for the child for the period of the requested leave. A lot of people may wonder whether this can be taken intermittently. This depends on the circumstances for paid sick leave and FML, but generally intermittent leave needs to be a mutual agreement between an employee and an employer. Now I will hand it off to my colleague, Julia, so you can learn about UI.
Hi, thanks, Juliana. I know we're throwing around a lot of terms and a lot of different layers of protections. It's sort of unfortunate that that's just the way that our laws are written, is everything is in a narrow box. So Juliana and I put the contact information for our organizations in the chat, and if people have individual questions about how they fit into these various boxes, you can feel free to reach out. But everything we've talked to so far is really about people taking leave from work and going back, or taking a paid leave from the EDD, getting wage replacement during that time. I'm going to move on and talk a little bit about unemployment insurance, which is usually when somebody has been fired. There's some unusual circumstances now under the federal law that I'll get into, but typically unemployment insurance you don't take when you're anticipating going back to the job that you had. You have to have lost your job through no fault of your own. This can include quitting in some circumstances. In general, it's much more difficult to access unemployment if you quit, but it is sometimes possible if you can prove basically that any reasonable person in your circumstance would have had no other option but to quit. The one other difference I want to point out about unemployment insurance that's very important is even though unemployment insurance is also administered by the Employment Development Department, the EDD, it is a separate program, and it is a requirement that somebody have lawful authorization to work in order to receive unemployment insurance. So undocumented workers cannot receive unemployment insurance benefits, again, which is different from disability and paid family leave benefits. So typically, unemployment lasts for 26 weeks, and usually there's a 7-day waiting period from the date that you have filed your claim. Both of these things have changed. So there's no more 7-day waiting period. That has been waived because of the COVID crisis. And the unemployment benefit amount in normal circumstances is somewhere between $40 and $450 based on past earnings. And again, typically unemployment is less than you will get from wage replacement for disability or paid family leave, because those are either 60 or 70% of your earnings. Unemployment insurance is less than that. And unemployment insurance can be used consecutively with disability insurance or paid family leave, but people can't get all of them at the same time. So if you're sick with COVID for 3 weeks and you get disability insurance, but then you also, your workplace has closed down, you might transition onto unemployment after that is over. And you want to apply typically as soon as possible because unlike disability and paid family leave, the EDD will not backdate your claim to the first day you were unemployed. Typically, they only backdate the claim to the Sunday before you applied. Again, if you can prove sort of extraordinary circumstances or good cause, they might do that. As a practical matter, with the volume of claims that the EDD is currently experiencing, historically high unemployment rates in the state, exponentially more than they have ever dealt with in the past, I do not recommend waiting to apply. If you are having trouble getting through to the EDD and therefore can't apply sort of in time, you can tell that to the EDD and they should backdate your claim. So one tip for doing this is like if you're trying to call to apply, take screenshots of your call log showing that you can't get through, or keep copies of the facts. The most efficient way to apply is by applying online. We do know that that's a barrier for a lot of people, particularly with language access. If that's possible, it's best. If not, try to keep records showing that you were trying to apply. And then there's some significant changes that have happened to the typical unemployment system because of COVID. So the federal government passed a law that changed the way that states administer unemployment insurance. Unemployment insurance is typically a state program that receives federal funding, and the federal government has sort of changed the terms of the funding now to really enhance benefits for people. There are 3 main ways that this is happening. The first is that people can have unemployment insurance for longer. So instead of the 27-week cap, there is an additional 13 weeks of benefits. So people might be eligible for unemployment for a longer period of time than they typically are. This applies to anybody who is receiving unemployment insurance for any reason, related to COVID or not. And then second is a whole new bucket of people who are eligible for unemployment. The government is calling pandemic unemployment assistance. And the reason it has a different name is because it's different than unemployment insurance. Unemployment insurance is available to people who are employees and have a sort of series of other eligibility requirements. Pandemic unemployment insurance is available to a broader group of people than that. And this really includes primarily people who are self-employed, gig workers, independent contractors. They can qualify for pandemic unemployment assistance, even though in sort of our normal way that we think about unemployment insurance, they aren't eligible for unemployment insurance. And then the third box of improvements that the federal government has made is that it has increased the benefit amount by $600 per week. So meaning that if you would traditionally qualify for somewhere between $40 to $450 in a weekly benefit amount, that's gone up to $640 to $1,050 per week. So it's a significant increase to the amount of the benefit. So three improvements. One is you are eligible for a longer period of time. More people are eligible who aren't typically eligible, and it is more money in folks' pockets. And this is just a little bit more detail about some of the additional people who are eligible. Again, the 13 weeks applies to everybody. And this can include people who have already used up their traditional unemployment insurance. Like if you were on unemployment insurance when sort of the shutdown started, you may, what if you were 20 weeks into your unemployment insurance claim? This is going to add additional time to that. And other categories of workers, including religious organizations who don't typically qualify for unemployment insurance, and primarily independent contractors, people who hadn't yet started at a job, so they aren't employees because they would have started at a job in 2 weeks, but that job has evaporated. So those are the sort of people who traditionally qualify, who qualify under the new federal program. And again, typically, individuals must be able and available to work This is a difference between unemployment and disability insurance and paid family leave, for example, because when somebody is applying for disability insurance, what they're saying is, I'm temporarily unable to do my regular job because I have a disability or health condition. So that person isn't actually available to work. And when somebody is applying for paid family leave, they're well, so they're not too sick to work, but what they're saying is I'm unable to work because I'm caring for someone else. Either I'm bonding or I'm caring for someone. And the reason you are getting unemployment usually is because you are able and available to work, but there is no work available for you to take. And we can go to the next one. We can go to the next one too. So again, the unemployment insurance is not available to undocumented workers. That includes under the federal expansion. And you apply from the EDD. And so that's the same agency that administers the disability and paid family leave programs, but it's a different application. It's a different branch of the agency. And the branches there's not sort of a cross-sector communication. You have to apply for the program that you are actually seeking. And just some tips about applying for unemployment and changes based on the CARE Act. So once you apply, you will get a notice that your application has been received, and it will include a calculation of your initial benefit amount. That benefit amount is going to be based most likely on the sort of traditional benefit period without a reflection of the $600 additional funding at this point. You need to certify that you are still eligible to receive benefits. So you're going to get a form, typically it's every 2 weeks from the EDD that says, hey, I've been looking for work, but I still haven't found anything. Please continue to pay my benefits. And then, for example, when someone finds work, they send that form back and say, hey, I found work on this date. Here's when I started work, so that the EDD knows to stop their benefits as of that date. One change that you'll see reflected here in number 3 is that workers are not going to be penalized for saying that they are not looking for work. Typically, you have to be looking for work in order to get unemployment benefits, and they will automatically disqualify you if you don't show that you are looking for work. That is different in the current circumstances because of the pandemic and because most workplaces are closed. So you do not have to be looking for work. It won't be an automatic disqualification the way that it was in the past. I would just caution folks as a practical matter, this is like a temporary sort of special waiver, and it is likely to go away as things start to reopen. So that's something that you're going to have to keep your eye on the EDD website about in terms of this particular requirement, because it won't be a permanent waiver. It's going to be a temporary waiver for the period that the EDD thinks it's necessary. And typically, it takes 3 weeks for the EDD to issue benefits. It's taking much longer than that now. When folks do receive their benefits, it will go back to the date that their application was submitted. So you do get the full amount. You just have to wait longer, which I know can be a real hardship for people. And you do need to continue to recertify with the EDD. And one other thing I just wanted to mention before I pass it back is all of the laws that we talked about, particularly the federal law that Juliana talked about for emergency paid sick leave and emergency family care leave, and the unemployment provisions that are changes to the traditional unemployment structure of the state are changing, and they are changing rapidly. So I anticipate that there will be additional changes to that, and so it's just important for folks to know that none of those sort of emergency provisions are set in stone, and I do think that they're likely to continue to be updated. So with all of that, I'm going to pass it back to Sophia to go over more putting it all together.
Great, thank you. So we're going to try to synthesize everything we've learned in the last hour and a half. So we're going to look at this story by Erica, and then in the chat box, I want folks to throw out ideas about what Erica might use, what type of paid leave or what type of benefits she might use. Okay, so Erica's mother has had a fever for a few days, and she's lost her sense of smell, which there's some information that might be an indicator that someone has COVID-19. So Erica's mom wants to get tested for coronavirus. Erica is an essential worker at the local supermarket. She works as a cashier for 35 hours a week in Garden Grove, and she's been working there for 2 years. So Erica really wants to take time off to help her mom self-isolate, help her clean and cook, but she's unsure if she takes time off now, how it will impact her job in the future. And Erica is also unsure how many days she's going to need off. She doesn't know if her mom just has a fever and a cold and is going to get over it soon, or it's going to be more long-term. So let's use the paid leave checklist to review options that Erica might have. Okay, so why is she using the time off? Here, Erica checked off one box, right? She said that she's going to take care of her mom, a family member's health, for 3 or fewer days, or it could turn into, hopefully not, but it could end up being more serious. And if her mom really is seriously ill, she may have to care for a seriously ill parent. But for now, she just put take care of her mom for 3 or fewer days. So what city does she work in? She works in Garden Grove in Orange County, Southern California. How long does she work there? 2 years. If she worked 35 hours a week and didn't take any time off, then she worked about a little bit more than 1,800 hours in the past 12 months. And it's a large grocery store, so there's more than 100 employees in a 75-mile radius. So she has a range of options. Let's go back to the last slide. Maybe people can share in the chat, and we'll just take maybe 1 minute to gather answers. What do you think Erica might consider as her paid leave options? Her mom might have COVID-19. It might turn into something more serious and long-term. She's not sure. So we can go to the next slide and just read it out. So if she's not sure how much time she needs to take off initially, she could use up her regular paid sick days first. Garden Grove does not have extra sick days, that are mandated on top of what the state mandates. So she can accrue, maybe she's accrued 3 days. She could use a couple days to take her mom to the doctor, rest at home, and wait for the test result. Paid sick days carries job protection in itself. So she doesn't really have to think about job protection if she's just using her paid sick days. Under the Families First legislation, she might have access to an additional 2 weeks at 2/3 pay to take care of a quarantined person. So again, this is the one that needs certification, and this would be if she would need certification that she's taking care of somebody who's getting tested for COVID or has COVID. And then finally, if her mom really is ill for a longer time, Erica could use paid family leave, and that's up to 6 weeks to take care of her mom. And with paid family leave, unlike paid sick days, you do have to think about, do I qualify for job protection? And in this case, she qualifies because she's been working at the grocery store for over a year, more than 1,250 hours in the last year. And the company has a certain number of employees. So what I'll say with the last story is, I think Julia mentioned it, is that unfortunately all of these systems are more confusing than they should be. And so that's why we need a 2-hour training to review, the range of different benefits you might have that are either like a government insurance, like paid family leave, or benefits that your employer is mandated to provide in the workplace, like paid sick days. But it's important that everyone think through their own situation, figure out what you might qualify for, and know that All of our organizations are available to help you navigate, to identify, to help you troubleshoot and request and document your requests for this type of leave.
I'm muted. I should unmute myself. Thank you so much, Sophia. That was absolutely fantastic. Thank you, Juliana. Thank you, Julia. That was great. Great information. There's so much that we just walked away learning. I am not a paid family leave expert. I am with you all here learning as we go through this. Just want to thank you all from the California Work and Family Coalition and the California Partnership to End Domestic Violence, all of our collaborators for being here. We do have evaluations that need to be completed. If you are receiving CEUs, your evaluation needs to be completed in order for you to receive your CEU. While we, let me load up the chat so I can see what is going on, so we have some time for question and answers. Let's see. Oh, I do want to say while the chat is being loaded, that Sophia was speaking about the checklist. So you saw bits and pieces of this checklist that you were all going to get access to through the Paid Family Leave Training Toolkit. This toolkit has been developed in collaboration with the California Work and Family Coalition and the Partnership to End Domestic Violence. We are creating this tool for you all to have everything in one place, to have easy to use tools like this checklist that you can use with your clients, with the folks that you work with, if you are an advocate, a community organizer, a preventionist, and whatever role you're in, having one piece of paper that can be easily used. It's going to be downloadable. We're going to get more into it in the next webinar, so make sure that you join us May 5th, same time, 10 a.m. in English, 1 p.m. in Spanish. We are going to have the recordings available. If you registered, we should have access to your email. You will get access to these trainings. The recordings are up. You can visit our websites for more information. Let's see where we are at with the Q&A. All right, so are these sick day laws, do they apply for per diem employees or non-benefited? Which one of our panelists would like to answer this question? Julia, Juliana?
If you're an employee, you get paid sick days. So even if you don't get benefits like health benefits otherwise, or you don't get paid vacation, you should still be accruing paid sick days. Julia, did you want to add something?
No, yeah, it depends on the person's relationship in terms of what per diem means, but employees are entitled to paid sick days.
Thank you. Next question. Can a person with reduced hours who applied for UI benefits get the stimulus amount of $600 even though the person makes more than the qualified weekly benefit amount?
So in order to qualify for unemployment benefits, you have to actually trigger an amount. So there were several questions about this, and actually the best way to figure out what the amount of benefits you would be entitled to is on the EDD's website. They have a benefits calculator, so you can enter in your wages, and it will basically look at the amount of income that you are losing and what benefit amount that would trigger. And unless you trigger some benefit amount, you need to trigger some weekly benefit amount in order to get the $600 top off. But it can be available to people who have lost part of their work, so like their hours have been reduced. You can still get some benefit as long as the reduction you have experienced is significant enough to trigger a weekly benefit amount. So I suggest people look at the EDD website benefit calculator to make sure that they are getting a weekly benefit amount, and then you will get the $600.
Thank you. Next question. Oh, was that an example? Yeah, that was an example from about June. That was awesome. I love that. If a client that was fired in January and applied for UEI and was denied, but since COVID happened, she is unable to find work and has no income, can she reapply? So
it sort of depends on what happened with the first claim and the circumstances in between. Normally a decision to receive UI is based on the way that your employment ended with your most recent employer. So one is that people who get denied can appeal that decision. And in fact, my experience is that many people are denied who are actually entitled to unemployment. So we recommend that people appeal, and you get sort of a whole new process. So that might be one option, because you do need to have a claim. You need to have an actual unemployment claim in order to trigger this extra 13 weeks of benefits and payment amount.
All right, let's keep Julia, Sophia, and Juliana on, please, so that we can answer the next question. If a UI recipient finds a temporary job 4 to 5 hours a week for a month or two, will they be ineligible for UI benefits? If they are still eligible, will their wages be adjusted due to their income?
Yes, your benefit amount will be adjusted based on the offset of the income.
Do we have a list of cities with their regulations or access to sick days?
I tried to remember off the top of my head. I know there's Berkeley, Emeryville, Oakland, LA, San Francisco, Santa Monica. Is San Diego also?
Yes.
There's a chart. I can put it in the box. An organization called The Better Balance has a nice chart that shows all of the local jurisdictions. And along those lines, there actually are a number of local jurisdictions that are passing emergency provisions now to fill some of the gaps in the laws that Juliana talked about, particularly the federal laws that she talked about providing emergency paid sick leave don't apply to employers that have more than 500 employees, but there are lots of cities around California that are passing laws that do apply to employers with more than 500 employees, including Los Angeles, San Jose, San Francisco, and Oakland, I think is likely to do the same. So we can put up more resources about.
Right, let's see the chat. You will receive an email with all of the information for so that you can access the previous recordings and these ones. Does paid family leave extension include fathers? My partner just wrapped up his paternity leave at the beginning of April. Is there an extension available for him? Our baby is 8 months old.
If you're talking about paid family leave in the sense of the wage replacement benefit from the EDD, then to get that 8 weeks instead of 6 weeks, it only applies to claims that are started after July. So if you took 6 weeks of bonding already and then you want to take a two extra weeks after July, you actually can't do that. It's only for claims that are initiated after the July effective date. If you're talking about paid family leave in the context that Juliana was talking about it because of school or care closures, then maybe, but like Juliana said, it doesn't give you extra time under FMLA if you've already used up all of your FMLA time.
You will be receiving the email. Thank you so much, Julia. You will be receiving the email with the link for the evaluation. I have a special note to RNs and IBCLCs. You will receive your CEUs SERPs by email after filling out the evaluation. After the webinar, participants will receive an evaluation to complete. After they submit the evaluation, a link will be provided immediately. Please click on the link. This will direct you to a form that must be completed in order for you to receive your certificate. The form will ask you for your name, first and last, and your license number if applicable. After completing and submitting the form, you should receive your certificate within 30 minutes. Thank you. Let's see. All right, so as I'm finding other questions, because I know there are there, I'm looking for them. Folks attended the first webinar. We looked at who is eligible, what is paid family leave, unemployment insurance, and all of this about. This time we looked at further, how do we apply? What is that all like? Furthering into the eligibility criteria and COVID-related benefits. Now, what is missing from you all? So for the third webinar, we want to continue this conversation, support you all with tools, resources that help you provide resources and information to others in your community. Also deepening the conversation on the resources that are most needed now. So again, please let us know, what is it that you need? What is it that you would like for us to deepen in the third webinar, which is happening on May 5th. So if you are with us, we still have a good group of folks with us. So exciting. Please let us know what other questions you have, what else you would like to have addressed in the next one. All right, let me see what else has come up. All right, I'm seeing a lot of folks did not receive the evaluation for last time. They did not receive access to the link. Please make sure that we have your correct email address. You can send it to info@, can you type that back into the chat, please, so that people have it accessible in chat in caps, info@workfamilyca.org. You have our contact information here. I would like to thank all of our trainers, all of our collaborators. This is not possible without you. We also want to let folks know that this is not the end. We have another series on, I'm going to keep saying it, May 5th, and we are looking at having after hours, evenings, weekend town hall forums, looking at other languages. We know that this is very much interest to our community. So please reach out to us. If you have any additional questions or thoughts for the next session, please send to us. I am also adding my email on here, and you have our contact information from when you registered. Thank you so much to everyone. Thank you for being here. We wish you health, safety, and well-being forever. Thank you. Anything else our panelists would like to add? Thank you so much. Have a wonderful rest of the week. See you on May 5th. Thank you. Stay safe, everyone. Thank you.